Good afternoon. I'm Dr. Bruce Garber, the director of the Philadelphia Impotence Foundation. And today we are privileged to have John, one of my patient advisors, come with us, and then he's going to give us some of his thoughts and feelings and opinions about his medical condition. So, John, thanks very much for coming. I really
Quite
appreciate it.
welcome.
And information like yours is really invaluable to guys who are struggling with erectile dysfunction. Now, remind me, how long have we known each other now?
I met you September of 2014.
Okay, so it's been a little over a year.
Mm-hmm.
And then I think I remember you developed ED related to surgery, right?
Yes, I was diagnosed with prostate cancer in late 2013. In February of 2014, I opted to have the prostate removed. And I had it minimally invasive, robotically removed. Everything was successful. Got rid of the prostate, got rid of the cancer. However, it left me with erectile dysfunction.
That's an important thing for people to keep in mind. No matter how skilled or how careful the surgeon and whether they use robotics or open surgery, despite that, almost every guy after having their prostate removed is going to need some type of help with their erections. I think you found that that was the case.
I found that out. Prior to that surgery, I had no problem at all. And I had a very rewarding and active sex life and love life with my girlfriend. And all of a sudden, after the surgery, I was left with erectile dysfunction. And I might add, the surgeon who removed my prostate was probably one of the finest in the United States. And he's right here in Philadelphia. So the skill, the professionalism, it's just the nature of the surgery. I mean, certain things come out and it leaves you with erectile dysfunction.
Right. Yeah, ED, not only is it a physical issue, but there's a psychological side. In other words, guys get ED, they're embarrassed, they're discouraged, they're depressed. You think you had some of those issues?
Well, the ED was bad enough, but what it did to me psychologically, emotionally, was devastating. I mean, I lost my sexual confidence. As a result of that, I lost my overall self-confidence. My self-esteem was down. I became depressed. I went to see my family doctor. I said, I need a medication. I can't take this depression. It was just horrible what it did to me emotionally. And
this is something that's really underappreciated. It's not just the loss of erection. It's the loss of your confidence, your sense of being a man, your ability to interact with females, your ability to establish relationships. It's a big psychological issue that goes along with the loss of the erection.
It was major for me, and I couldn't go on living like that. I mean, it was just too unpleasant, too uncomfortable, too miserably unhappy.
Right. Now, in terms of the treatments, I think you tried the pills initially?
Well, when I was discharged after the prostate surgery, the surgeon had prescribed Cialis daily, 5 milligrams daily, and I took it religiously every day. And within 6 months, I mean, I had no inkling, no stirring, no nothing. In my heart of heart, I knew it wasn't coming back. I thought I should feel something. I mean, in 6 months, nerves, blood vessels, they mend. I should be feeling an inkling of an erection. I mean, nothing was happening. And I consulted my regular urologist who diagnosed the prostate cancer. And he said, my experience has been, if you don't have an inkling, it's not coming back within 6 months, it's probably not coming back. So I wasted no time. On the 7th month, I called your office. I made an appointment, and I came in for a consultation.
Let me ask you this. Aside from the pills, did you try any other treatments, like the needle or the vacuum pump?
No, I had no desire. I wanted something as normal and natural and as realistic to the real thing. And I had researched implant surgery. I knew a little bit about it, and then lo and behold, I found your website. And I knew your name, I knew your reputation. I said, boy, how lucky is this? He's right here in Philadelphia where I live, and let me go see this man. This could be the answer to my problem. And sure enough, I made the appointment, I came in.
And that was what, about a year ago?
That was September 2014.
Okay, a little bit over a year ago. And then I think we did your procedure, when was that?
It was January 15th of 2015.
15, okay. Do you remember, did you have much pain or discomfort afterwards?
No, I had slight discomfort. You had given me a prescription for pain medication, and if I don't have to, I don't like to take such medications. I took Tylenol, and the discomfort I experienced, I mean, it was resolved with Tylenol.
Mm-hmm.
In fact, I had a little bit of scrotal swelling. I used ice packs, and I kept the swelling down. The surgery was done on a Thursday, and on Saturday, I felt fine. I got up, and I went out, and I drove my car. You know, not radically, but lightly. I ran a couple of errands and got myself out of the house. Came back home, iced myself, every couple of hours. Took the Tylenol, and I mean, in a week or so, it was non-existent anymore.
Okay,
I just
good.
had to let the surgery heal.
And of course, we got you the fully inflatable device. That's the best type available. It gives you the best rigidity, the best flaccidity. That's the type that we selected for you, the fully inflatable model. Now, after we do it, we have to let it heal up, typically about 6 weeks or so before you can start to work it. Then we show you how to work it. Is your device easy to work?
Very easy to work, very natural.
Does it give you a good result, a good erection?
The results are excellent. The erection is better than my normal natural erection before the implant. I mean, it's like I'm 17 years old again, and it's rock hard like a 17-year-old.
Right, because you can control it by how much you inflate the device.
Yes.
You can inflate a little more, a little less, depending on what you prefer. Does it give you all the normal pleasure,
All sensations, everything is the same. Everything is the same.
Mm-hmm.
And the only difference is my girlfriend keeps saying, wait, it doesn't go down, it doesn't go down. How much better does it get than this?
Mm-hmm. Right. How about now that you've been through it and you're healed, how would you say in terms of the psychological aspect? Do you feel better about yourself? Or?
It's all back again. I mean, my sexual confidence is back, my self-confidence is back, my self-esteem is back. I feel on top of the world. Mm-hmm. And I've got a very happy girlfriend.
Yeah, this is very unappreciated, that when guys get ED, there's a huge psychological side that goes along with it. And conversely, once we correct the ED, a lot of that psychological stuff goes away. You get rid of the depression, the anxiety, the performance anxiety, the loss of self-esteem, all goes away. And that is one of the reasons I like helping guys with ED, because it not only restores their erection, it restores their sense of well-being.
The other thing I might add, I mean, if anyone is fearful of coming in, I mean, men may feel embarrassed. They've got ED, they feel less than a man. They don't feel comfortable talking about it. I mean, it's a fact of life. Talk about it. You can get help. You can overcome it. You can get your life back again.
For most guys, it is a physical problem. And the main thing to remember is, in almost every guy, we can correct it one way or another. Some guys just need pills, some guys need an implant, but one way or another we can correct it for virtually every single guy. The other thing that I think people ought to keep in mind is that, like with any other operation, it's far better to go to someone who's doing a lot of them than someone who only is doing a few a year. Wouldn't you agree with that?
I would definitely agree with that. My regular urologist, I told him I was considering an implant, and he said, well, I do that. I said, how many have you done? And he said, oh, maybe a dozen. And I thought to myself, he's a good urologist, but he's not a good implant surgeon. I said, I want the best of the best. And when I researched it, I found that Dr. Garber had done thousands of these surgeries. I thought, that's the man I want to do it. He has the skill, the ability, the wherewithal. And I have absolutely no regrets. I made the right choices.
Right. I think that applies to almost any operation.
Same
thing with your prostate. You're trying to find the best guy around.
I look for the best.
Yeah, same with any operation. Far better to get it from a guy who's doing a whole lot of them than someone who just dabbles in it or does a few.
That's right. You want an expert. I mean, if you get an electrician, you get a mechanic for your car, you want the expert. I mean, medical care is no different. I want the best of the best, and I want the expert to work on me.
Right. I have a fair number of patients coming to me, and they've had their procedures done elsewhere by doctors who don't do a lot of it, and many times they need revision surgery. Many times.
Unfortunate for them.
But usually we can straighten them out too. Any other advice for guys who are struggling with ED?
Yes. Don't hesitate. Don't question it. Make an appointment with Dr. Garber and investigate what can be done. I mean, you don't have to suffer with this. And it's a very easy, simple surgery. It was an outpatient surgery. I went in the morning, came out home in the afternoon, and In 6 weeks, I was completely healed, using it, and my life came back. And don't wait, don't put it off. I mean, why waste chunks of your life? Just do it sooner rather than later.
Many guys tell me that. It's something I frequently hear. Once they get it done and they're healed and they see the benefit of it, they tell me they wish they had it done sooner.
Well, I wasted no time. I was in Dr. Garber. I was in your office within 7 months or actually about 6 months of having 6 to 7 months of having the prostate surgery. And I said, I'm not going to live with this any longer. I want it remediated as quickly as possible.
Sure. Some prostate surgeons like their patients to wait like a year or 2 or 3 years. But, how long can you wait for something that may not be coming back?
The surgeon told me that it's going to take a year, maybe a year and a half, but, it's all well and good what the surgeon told me, and that may be a cross-section of some of the patients he treats, but I was on that Cialis, I was on the 5 milligrams daily. I mean, in my heart of hearts, I didn't get a stirring, I didn't feel like, I felt everything was healed, nothing was happening. I just knew it wasn't coming back. I wasn't going to waste time. I wasn't going to wait another half year, another year and a half. I wanted it done, I wanted it corrected, and I'm so glad I did it.
Any feedback from the ladies?
Yeah, my girlfriend just can't believe her good fortune. She said, boy, I thought it was good before. She said, it's great now. And I mean, we spent a lot of time in Florida. She's talking to women her age whose husbands have erectile dysfunction. You have to see how fortunate John was. Let John show you what he has. It's just absolutely amazing. Your husband doesn't have to suffer with this. I mean, she's a spokesperson. She's so happy with it.
Well, now you see why I like this line of work. I get to help a lot of couples out of a difficult
Absolutely.
situation.
You bring joy and happiness into guys' lives and in their wives and significant others. You're a lucky man.
Okay. Well, listen, thanks very much. We
Thank
really
you.
appreciate your thoughts. It's extremely valuable to guys suffering with this problem. So thanks again for coming to speak with us.
You're quite welcome.